Namaste all our viewers, subscribers and those whosoever are going to watch these videos. We thank you all for subscribing to us, taking your valuable time to watch our videos, give your likes and also share among your needy ones around you, maybe peers, friends, relatives. It makes a lot of difference and encouragement and inspiration for us to make several other videos, for us to make sure that the right information reaches at the right time and the right people get the solution for it. Our videos are focused on health, well-being, preventive health care and also disease management of several diseases. You can see several videos in our channel. We have nearly reached about 125 videos as of now on several topics and how to deal with several diseases with natural healing solutions of naturopathy, yoga and acupuncture. In this series of talks, we wanted to touch upon a very important topic today, which is very less spoken and probably not addressed also that well: male infertility. How do we get to know? Most of us, we don't even know that whether we have this problem or not. Unless after the marriage you don't get to father a child for a long time, then we start thinking about it, and then when you approach the doctor, they'll ask you to do the necessary tests which are required. Only then we recognize I have a problem. And male infertility is not recognized that much as female infertility. It's a taboo in the society probably. That's also another reason why we don't blame ourselves, or we take on the blame on ourselves, and we are also responsible equally for a child to be born. 50-50, male and female both are very important. It's unfortunate that many a times we put the blame on the lady and she is responsible for not getting the child, but actually it is the male equally important. So now with the awareness increasing, lot of information on the internet and talking to people have broken that chain and coming out and speaking about it, talking about it and also trying to understand. So let us put some light to understand on all those aspects today and how we can deal with it naturally in early stages when it is recognized and addressed as well. What are the most common male infertility issues we have? It is the three important aspects. One is low sperm count. Other one is the motility. The sperm has to swim through to become fertilized with the ovum. So the motility issue. And the last one is the abnormal shape. I don't want to talk about the technical terms about it, but these three things are very important: volume, motility and the shape of the sperm. If all these three, if any one of them is not okay, then it doesn't enter the ovum and cause the fertilization and the fetus accordingly. What are the probable causes today? This was never, maybe about 20-30 years back or maybe 50 years back, this was not a big important aspect, at least in India and across the world as well, because the children being born was very easy and very natural after marriage. It was nothing to be worried about. So, but today it is not happening. The number of cases of infertility are increasing day by day. In one of the statistics recently when I was reading on the newspaper was telling that about 5 to 6 couples in urban society are infertile today. Maybe for various reasons. We don't want to talk about the reasons today, but for various reasons, this is the situation according to the statistics what we are in. So that's why the awareness is increasing, the education is increasing, and we are talking about it. Let us try to understand what are the probable causes for these three abnormalities in the sperm quality and volume and the motility. One of the important factors is lifestyle. We would address the lifestyle as the most important. If you see even in the historical perspective, in the last 50 years, what has that changed a lot in our lives as a society? It's the lifestyle which has changed. When I say lifestyle, it includes stress, lack of exercise, lot of sitting, and obesity. These are the main reasons which causes the infertility in male. And next one is infections. Some of the infections may be in the prostate or in the usually our testicular area is very well protected, but at times that also is a factor. Infection is one of the major factor. Third thing is genetics. That is another factor which can happen, very rarely though. And the last one is certain medication. On long-term medication, if someone is there on certain medication, that can also have an effect on the sperm quality and the motility issues as well. So these are the main reasons why the male infertility is on the rise today. And one more important aspect is the blood flow to the testicular area is very, very important. So that is another reason why there could be any abnormalities in the blood flow. We call it as varicocele when there is a problem with that. That can also lead to abnormal sperm production or the function of the testicle being deficient. That's also another reason. There are all treatments today to work upon. First important thing is we have to work on our lifestyle. Don't depend on medication for everything. Even on medication also, it cannot be given on a long-term basis. It can have impact on your overall health on a long term, which we don't want to pay a big price for. So apart from medication, we also need to work on our lifestyle, reduce our weight and not sit for long hours. Sitting for long hours and using laptop very close to us is one of the main reasons for varicocele, and the abnormal flow of blood, abnormality in the flow of blood to the testicular area is one of the reasons these days we are finding as the main reason for varicocele, and thereby the sperm production being affected. So another important reason is weight management. That's also very, very important. We should make sure, and mobility. We have to make sure we move well with proper exercise, maybe walking, whatever suits you, swimming, cycling, gymming, whatever is good for you. And also managing our stresses is very important. Stress can increase our cortisol levels, can cause deficiency in other several hormones which is responsible or needed for proper production of sperm, good quality of sperm. So stress is also a major factor to be worked upon. How do we deal with all these things? Apart from medication, work on your lifestyle as I mentioned, and also work on your stress. Stress could be managed through yoga, acupuncture, massage therapy. For someone it can be music therapy, someone it can be painting and gardening, or for someone it is socializing as well. Whatever suits you the best, so that you get off your mind of your too much of focused work or anything for that matter. So when these things are working well, automatically we have seen lot of progress and improvement. I can have n number of cases which have improved with our therapies, which deals with lifestyle management and also stress management, to work on the improvement of the quality of sperm, volume of sperm, and also motility. All the three things can happen. So how does we make it happen? After thorough consultation and understand what are the causes for their problem, we plan the treatment accordingly. In the treatment, we include yoga, we include lifestyle management with advices, and acupuncture. On acupuncture, I want to speak very specifically because we have found very, very promising results with that. Improving in the quality of motility, improving in the morphology, what we talk about, the quality of the sperm, and the volumes as well. We use specific points which improves the blood flow to the testicular area and also help with the stress management, reduce the cortisol levels, which is the hormone of stress, and thereby improve the production of the sperm and its quality. So that's how acupuncture can be a great tool to help. Along when complemented with your lifestyle changes and yoga included into it, it can make things dream come true kind of a outcome. So I'm sure this much of information is good enough to deal with any kind of male infertility. If someone is having any issues within your group or within your circle, please advise them or give them a suggestion that this could be a good solution for them to look out for, apart from if required some supplements and vitamins as well. I'm sure this information is good for you. Thanks for your valuable time. Do subscribe to our channel and reach us if you need. Thank you.